A very good morning to everyone. Welcome to today's session on diet in pregnancy by Apollo Cradle and Children's Hospital. To speak on the topic, we would like to welcome Dr. Seema Tareja, our in-house consultant, obstetrics and gynecology. She has done her MBBS and MD in obstetrics and gynecology. We welcome you, doctor. You can now take over the session.
Thank you. Uh, Today I'll be talking about diet and nutrition in pregnancy. As we all know, every woman who is planning motherhood always tries to have a healthy baby. Now, to have a healthy baby, it is important to have a good, healthy lifestyle and good nutrition given to the mother. Both the things, the lifestyle as well as the diet and nutrition, are important to have a healthy, normal baby. Now, as we all know, nutrition and lifestyle plays a major role. Now, on an average, in today's time, most of in India we have two spectrum of the population. One spectrum is of a good socioeconomic class, which has a very good healthy nutrition wise lifestyle, but the lifestyle is not too good. And the other spectrum is uh, malnourished categories. Both the categories have effect on the baby's health. So if the mother is in on the spectrum which deals with obesity, very sedentary lifestyle, and good nutrition status, I would say, obese and overweight. Now they have a tendency to have hypertension, diabetes, large for date babies in pregnancy, and later on their babies also tend to have more of obesity and lifestyle disorders like diabetes and hypertension and asthma later on in life. Whereas the other spectrum, which is malnourished, now these women deal with anemia, low maternal weight, so their babies tend to have low birth weight, prematurity, stillbirth, and anemia also leads to various problems in the child and growth restriction. So this tells us that nutrition and adequate care during pregnancy is very important. Now, averagely speaking, in pregnancy, women needs extra about 300 calories more than her normal non-pregnant status. Now this, it could vary depending on the BMI and the initial weight of the mother. So averagely speaking, we take it as 300, but it can range from 300 to 500 depending of the if the mother is very uh, low weight initially, so then she can afford to have more calories. But on an average, 300 calories extra in pregnancy is what all is required. So the myth that in pregnancy you need to eat for two is not really correct in today's time. The question is, whatever you eat should be nutritious and it should be balanced. Now, these two things are important. It's not only the quantity of the food that you're eating is important, it is the quality also, which is important. Now, as I said, the diet can vary depending on the mother's initial uh, status, BMI status. And of course, the diet also varies from region to region and area to area. And this 300 calorie extra, which we need to take in form of, it should be uh, balanced in the sense that it should contain carbohydrates, proteins, vegetables, fruits, dairy milk products, and as well as various micro and macronutrients, which we add as a supplement. So the minor micro and the macronutrients like iron, omega 3, DHA, these things may not be the patient may not be able to take it completely in the food. So we add these supplements in our basic vitamin or nutritional supplements, which are commonly given to all women in pregnancy. Now we can split the diet requirement in the various trimester, like first trimester, second trimester, and third trimester. As you all know, pregnancy is divided into three trimesters. Now, in first trimester, the diet, we don't pay too much stress on the diet because in the first trimester, the reaction to pregnancy is very variable in every woman. Some women have a lot of nausea, vomiting, or hyperemesis, and they are not able to eat too much or retain too much. And some have no complaints at all. So in first trimester, one should be, since the body is adapting to the changes of pregnancy and the brain's reaction can vary a lot, we don't put too much stress on the mother regarding diet and nutrition. All that is recommended is that she should be hydrating herself well and having frequent meals. And the diet should have more of folic acid and vitamin B6. So, in terms of fresh fruits, juices, liquid intake, and a few nuts and all, which vitamin B6 tends to prevent the nausea and vomiting or helps in nausea and vomiting. So mainly in first trimester, the supplementation is of folic acid since the requirement is more. It prevents the neural tube defects in the first trimester. So all women who come to the clinic in first trimester are given a supplement of folic acid and B6. And food, we just recommend that the food should be hygienic, not contaminated, so that you don't fall sick. What food you are eating, how much you are eating in first trimester, just don't be stressed about the amount and the quantity of food. Because as I said, first trimester is the weight gain is also not too much. Your women may gain a 1 kg or 2 kg in the first trimester. And some women tend to lose weight also in first trimester because of their excessive nausea and vomiting. So nutrition in that sense, you don't have to worry too much in first trimester as long as your nausea vomiting is controlled. You just the food is related to that only. If your brain doesn't like any strong smell, flavor, and you tend to throw up, we don't insist that the patient should be eating these things. It's the second trimester when the nausea vomiting gets better, and automatically your appetite also gets better. And it's in the late second trimester. It's then when actually the development is by then almost complete and the growth kicks in. So it's then when that's when the nutrition in terms of food is important. So that's the time when we insist that you should be having a balanced food. Now, by balanced, I mean what a basic Indian meal contains carbohydrates, contains proteins. So, carbohydrates, all of us, depending on which region and which area we live in, we tend to have it in form of cereals. So, any kind of cereal, whether it is wheat, ragi, bajra, depending on where you're staying, rice. So, all these whole grains are better than the polished grains. So, carbs are mainly derived from the various cereals. Then, second important aspect is the protein. The protein is the bodybuilding unit, as we all know. So, for fetal growth and development, proteins are required. Proteins, as you know, are present in all our pulses, and so it could be all types of dals, and the whole pulses like rajma, chane, chole, all of them have this thing. Then, like soya bean, paneer, all these are protein rich sprouts. And if you're a non vegetarian, then you have a non vegetarian source of protein in terms of non veg and egg. But you don't have to be stressed that if you're a vegetarian, your protein intake won't be taken care of. You can always mix match, and various types of pulses and other foods like soya bean and basin and all do provide protein. So you don't have to become a non-vegetarian to complete your protein intake. And if you want, you can add any protein supplement powders also, which are important. So in second trimester is the time, and during this time also one has to look that your hemoglobin is fine, your sugar is fine, because these things also affect the growth of or development of your baby. So if the patient is anemic, the anemia has to be corrected, of course, by oral supplementation and taking fruits and food which is rich in iron. So green leafy vegetables and fruits which are rich in iron should be consumed if you have iron deficiency. But food alone sometimes doesn't cover the iron deficiency. It has to be supplemented with the oral medication, which your doctor will definitely prescribe. And sometimes, because of added vitamin B6 deficiency in India, because of being a pure vegetarian, this also adds on to your anemia. So, the supplementation is always given with iron and B6 to improve your this thing. But if you are a diabetic in pregnancy, then yes, it's a whole set of different regulation for your diet. So those are special cases. If you have hypertension, you have diabetes, you have other medical issues, then your diet is to be tweaked according to your calorie requirement and intake and according to your insulin resistance present. So, as you all know, the diet then varies according to the circumstances. The third trimester is a time when the women has to get ready for delivery, and of course, the growth of the baby is also going simultaneously in third trimester. So again, in third trimester also, we recommend that your protein intake should be good. Along with it, your fiber intake also should be good because your gut flora also affects all the absorption of the nutrients, the micro and the macronutrients. So fluid intake, fiber intake, and a protein intake, along with carbohydrate intake, is important to have a well balanced diet. Now, regarding fat and fat calories have a role, but your major calories in 300 should be coming only from the fat calories. So, good fat is fine, but if you're eating too much processed food or junk food, now these are wasteful calories, so they are not nutritious for the mother and neither they are nutritious for the baby. It's not that you can't eat them, but if you are too much into indulgence food, then that's not really recommended. If you really want to indulge yourself, the portion size should be small of basically junk food or very, sweet desserts and high calorie, high fat calorie food. That portion control should be controlled because as I said, overweight mothers tend to be diabetic. Then all these have a bearing on the baby's development and the future life style of the baby is also gets affected. In a diabetic mother, the and obese babies, overweight babies tend to have later on diabetes in their life. So the mother has to, we have to plan the nutrition or the health of the mother in terms of prevention of these lifestyle disorders because they can easily be prevented if the mother's health well is looked after well. So that's regarding the diet. And so now any questions, then I will just take them. So the first question is how much caffeine consumption a day during pregnancy? So see if you are, or if you take 1 or 2 cups of coffee or 1 or 2 cups of tea a day, that is within the normal range. It is allowed. But if you really drink it in large quantities, like 6, 7 cups of black coffee a day, then that's a lot of caffeine. That is not really recommended. Second question is how can food poisoning affect my pregnancy? Now, see, food poisoning is a very general term. Like if you have a stomach upset by eating a food which is cooked at home, then you need not worry too much. Then it is just a mild upset. There are no toxins or food poisons which are running in your blood. So they will not affect the baby and it usually settles in 24 to 48 hours. But if you had really street food which was really contaminated with some microbes like bacteria or some parasites like worms, then maybe you have a severe gastroenteritis, and in that sense, then yes, you will have vomiting, loose motions, and fever or cramps. So that means there is some amount of toxicity in your blood, and that toxicity will reach the fetus also, or the baby also. So we need to treat that food poisoning, and then yes, antibiotics or accordingly are recommended. So you shouldn't shy away from taking the antibiotic if you have a bad bacterial infection or gastroenteritis. The next question is it okay to consume full fat milk? Or see, as I said, in pregnancy, milk is recommended for the intake of, in terms of calcium requirement, So, a skimmed milk will also do the same job. So, as far as we are concerned, a skimmed milk is fine. There is no need to add full fat milk. But if you like the taste and you take it in moderation, you're not overweight, you don't have hypertension, diabetes, or any other lifestyle or comorbidities, then you can take full fat milk also. It's not that full fat milk is harmful for the baby. It is just that it is added fat calories, and depending on your BMI, depending on the mother's health, she can decide whether she wants to take those fat calories or not. The next question is it okay to consume seafood during pregnancy? See, it depends on which area you are staying. If you get fresh seafood, which is not contaminated with various pesticides and the various chemicals floating in the water, then seafood is fine. But yeah, but if the seafood is contaminated, then food poisoning is very severe in seafood food poisoning, which can be serious. So, in that sense, yes, whenever you consume seafood, you have to be careful as to which, where the seafood is acquired from. So, that is important regarding seafood. Otherwise, all the other non vegetarian red meat or white meat is okay. Otherwise, if you're a non vegetarian, as long as the sourcing is from a good place and it's not stale, it is not contaminated.
Yeah, hi, doctor. We just have one last
Any
question.
further questions?
Yeah. They've asked us, can we consume ready to eat or packaged food during the term time? Doctor?
Uh,
They've asked, can we consume ready to eat or packaged food during the term?
yeah, as I said, processed food and packaged food is not really healthy if you take in terms of nutrition. There is no side effect in having it. It is just that you're eating useless calories, which are not good for you, neither good for the baby. It's not going to harm the baby in any way, but it is not going to be fruitful or nutritious to the baby also. So, as long as you're consuming it, you are eating your healthy, balanced diet, and extra you're taking little packaged food is absolutely fine. But if that is your main source of nutrition, packaged food, ready to eat food, irregular eating hours, then that's not really recommended. We usually recommend that you should be having fresh, easily sourced, seasonal food, freshly cooked, and regular meals, 3 meals, and with in between snacking, depending on how hungry you are in between your 3 full meals. There is no role of skipping meals, and there is so prolonged fasting, prolonged interval between your food is not really recommended. And then when you are hungry, then you pick up a packet of chips and eat, then that's not recommended. We would say rather have a sandwich if you can't cook or you haven't cooked. Try to supplement, even if you are having, easily cooked meal, it should be, try that it is not really opened from a packet and with a lot of preservatives and the junk calories. But yes, some portion can be allowed.
Right, doctor. Thanks a lot, doctor. That was such an informative session today on diet during pregnancy. We look forward to having you on more such sessions, doctor. Thanks a lot for your time today. Thank you.
Thank you. Thank you.
Thanks a lot to everyone who's attended today's session. Please keep watching this space for more such sessions on different topics. Thanks a lot. Thank you, doctor.